May is Stroke Awareness Month, and I think that's a really great time to do some stroke myth busting because it's very important to talk about it. A stroke affects about 800,000 people in the United States annually, and about a quarter of those are not new strokes. They're repeat strokes. So the amount of information and education that is so important to be able to prevent a recurrent stroke from happening is really vital. One of the most important things is that stroke, of course, affects the elderly. That is a big myth. Strokes happen at all ages, from childhood to advanced adulthood and advanced ages. But there's some literature that supports saying almost upwards of 15% of all ischemic stroke presentations worldwide are in young adults and children. And they just get missed, they go undiagnosed because we have this kind of bias a little bit that they don't happen. So not necessarily in emergent situations are we always looking for them. Another one, stroke myth, is that if you're experiencing a stroke, you'll know. And for somebody experiencing an acute stroke, their brain is currently being injured and they're not really in a place to be able to make judgments or make decisions or even recognize the symptoms, because ischemic strokes, they don't hurt. The majority of people experiencing ischemic stroke don't have a headache. And so that would be the biggest driver of getting people to call 911 or getting them to the emergency room. And then the third big myth is that if you're experiencing an acute stroke and you just had surgery, you're not a candidate for intervention. And that's not true. We don't know until we do the workup.